Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to our weekly podcast, Redefining Medicine. I am pleased to welcome Dr. Tim Schroeder, a pharmacist and business executive based in Alaska. Dr. Schroeder, thank you so much for being with us today.
Thank you. Appreciate it.
Dr. Schroeder, you have some background experience working in business before you began studying pharmacy. What drew you to medicine?
I think it was a combination. I was in the oil and gas business, and it's pretty cyclical. And my background is in biology, molecular chemistry, so different areas within this life sciences. I am a chemist by trade. I do have a master's in chemistry, but my other passion is biology and medicine. So I decided to get out of the oil and gas business and become a pharmacist.
What led you to decide you wanted to start the fellowship program with ABAAHP?
I realized quite early, probably my first year of pharmacy school, I always have a passion for questioning just the kind of the mainstay of medicine. When I was in pharmacy school and we were being taught all these different medications and stuff, I in the back of my mind, I said, is this really what I'm in pharmacy school for 4 years, is to just give people medications and hand them out? And it's an important role that we have as pharmacists to communicate side effects and how medications work. But I thought there was something more to what medicine could be. I thought there's got to be a lifestyle component. There's got to be a nutritional component. And part of it too, and I realized once I was a pharmacy owner and I had ladies come into me at my pharmacy that we call it polypharmacy, where they're on multiple medications. So I'd had patients that would be on like 15, 16 medications, all these side effects. And I was like, man, there's got to be something more than what we're doing, something, because it's not working. And to me, there's got to be something more. So that's what drove me to look for something else besides just, and I'm not saying, Western medicine's bad, but I think, there's something lacking. So that's kind of what drove me to question what else is out there that we could be doing that could help people in the long term.
Dr. Schroeder, what then drew you towards board certification?
I wanted credibility, and I think ABAAHP is a good organization. And when I looked into their fellowship program, I thought that would give me credence or give me some credibility in communicating lifestyle, nutrition, and other things to my patients, and of course to my fellow pharmacists and doctors and nurses and stuff like that, just to have that board certification and credibility.
Thank you. How do you think your background and experience as a business person has impacted your approach to medicine, if at all?
I think it's driven me to look beyond the standard of care practice that we have, because typically right now in the pharmacy space, pharmacists are only getting paid by the medications we dispense. So I've always tried to look at how can I grow a business or interact with patients, but get paid for it. So I charge for my time or my services. Typically in the standard practice of pharmacy, when we dispense medications, we'll go over the side effects and stuff with patients. But from an ABAAHP perspective or a nutritional weight loss or management or hormones, I'll let patients know up front, hey, this is what I charge. I'll charge $125, $150 an hour. I'll charge 15 minutes, 15-minute increments. But I'll let the patients know up front, and I'll tell them, say, hey, look, if you were to go to see a medical provider, they're going to charge you for their time. My time to sit down with you and go over your hormones, make any kind of recommendations for nutrition, weight loss, that requires an expertise that I had to pay for out of pocket, and you're getting a service that I'm providing. So that's how I go about charging patients for consultations. It's not covered by insurance, and patients are very understanding of that. It's like any other service. You're going to have to pay for it. So it's not it's not tied to any drugs or medications. That this is above and beyond what I'm doing for the patients. And once they see the value in it, they'll usually come back and talk to me, and it'll be a repeat consultation. So it just won't be one time. Patients, once they see the value and what you're doing and what you're providing, because they're not getting this at the doctor's office. If doctors could spend more time with patients, they'd be able to go over a lot of this stuff with them, but they're not able to because you got 15 minutes. The doctor's got to get in there, boom, boom, and get the patient out, and I got to see my next patient. So I provide a service that I think is valuable. It's longevity medicine, so it's anti-aging functional medicine, something they're not getting, they're not seeing at the doctor's office. So they appreciate that and they see the value. I think it's part of my job to educate the providers. In fact, I've had that issue up here in Alaska. I have a different mindset when I talk to patients and see labs. I look at from an ABAAHP perspective and what we've been taught and how to look at labs and how to educate patients. So to me, it's just part of it. It's an extension of educating them and showing them. Sometimes they'll want to see the literature. Hey, where's your evidence? Where's your evidence-based medicine for this? And I'll show them because I've got all the research and stuff from my fellowship. So I just think it's part of my role is to help educate them. And once they see it and they see a change in their patients, a light bulb will go off, and they're very appreciative. They'll be like, "Hey, yeah, you taught me this, Tim. I learned about this, and it helped my patients, and now I could take that and use it for my other patients in my practice."
Thank you so much for being with us today, Dr. Schroeder. We appreciate your insight and expertise.
Thank you. I appreciate it.
And thank you to all of our listeners. Until next time.